Resisted, I'll just go through it from elbow through to wrist and hand, same as before. So my hand wants to be obviously on the elbow joint. Move the pillow over if you think it's required, just to give you the room. Move your client to the edge of the chair if you think it's going to help you in terms of going through the movement. But get mid-range, ask the client to push the hand down to the floor. And as I hold the elbow, I'm feeling for anything happening in there. Any pain or discomfort as you do that. And what they're doing is they're matching your force. If they try and push too hard, you just go with it, say, not as much as that, if you just match my force the next time. Because you don't want them to injure themselves, especially with this movement, because we're testing power and strength in contractile tissue. Hand over the forearm, if you like, hand on the elbow, asking her to pull up towards the shoulder. Any pain or discomfort as she did that. So again, you're just looking for facial expression and comparing and contrasting both sides as you do that. Get yourself in a good position. Now, I'm watching a few of you do this. A lot of you are doing this with your backs. You're going to stress your backs. So get yourself down low. If it means you have to get a good wide base of support, please let me see you doing that. Hand on the elbow. Again, same as you did with the passive movement. Bring it into mid-range. Ask her to bring the palm down towards the floor, but what I'm going to do is offer resistance. Hand on the elbow, if you could do that for me now. Any pain or discomfort? All I'm going to do is just change my position slightly, ask her to bring the palm up towards the ceiling. Any pain or discomfort? Now you can do that with a handshake if you want, if you do the same thing, but my view is look what's happening to the wrist.
It's just twist.
Yeah, then do the other way.
Resistance is on the, then going for the elbow and wrist, and then we have.
You wouldn't get a true indication.
You'd probably find that they have a issue with the wrist more so than we'd have up here, and it puts more focus on that. So that's why I quite like taking the wrist out of the equation altogether. But you will see some, for some of you going into YouTube, you will see versions of doing it like this. Okay. But if you could try and have a go at that, that would be a good way to start. Okay, so we've done resisted flexion extension, resisted supination and pronation. So now we're going to move into the wrist. Use the pillow on their lap, and again, same idea as before. Think about the positioning, whether it's over the top or underneath into the extensor grip. You decide. What I'm going to do is bring her into mid-range and ask her to push the back of the hand towards the floor. Any pain or discomfort? No. Change my hand position, ask her to bring the palm up. Any pain or discomfort? Doesn't have to be a lot, just a little bit. You're looking for facial expression, how she feels when she does this. Hand on the wrist again. I'm going to take it into ulnar deviation, ask her to bring it into radial deviation. Any pain or discomfort? No. Do the same there. Any pain or discomfort? Now I can do this way. Bring the hand down the way. Any pain or discomfort? Bring the hand up the way. Any pain or discomfort? You can decide how you go about doing that. Both of them equally as good. Okay? So that's done the wrist, resisted. I'm going to bring the hand across the hand, my thumb across the palm of the hand, targeting the metacarpophalangeal joints. I'm going to ask her collectively to bring the whole fingers down towards the floor. Any pain or discomfort? Bring them down, ask her to bring them up. Any pain or discomfort? Now at that point, no pain, no discomfort. Do I have to proceed with individual targeting individual muscles? No. What I would say you do though, you've done the metacarpophalangeal. I'll do the proximal phalangeal. Push down towards the floor. Any pain or discomfort? Pulling up. Any pain or discomfort? Nothing. Take it up to distal. Now you can see the different sizes in the pinky. I can do that individually if I have to, but what I'm going to do, fingers down towards the floor. Any pain or discomfort? Fingers up. Any pain or discomfort? I can do the pinky individually if I need to. Now at that point you'll have an indication, is there something going on? Which means that then you would go down the individual route. Okay, hand across to target the metacarpophalangeal, finger down towards the floor, any pain or discomfort, finger up towards the cells, any pain or discomfort. Change the position of your hand. Bring it between the metacarpophalangeal and the proximal phalangeal. Push down towards the floor, pull up. To do the distal phalangeal, move between the proximal and the distal, push down towards the floor, pull up towards yourself. You can actually get an indication of perhaps when somebody, for example, staved their finger, it's quite clear that that's the finger that's the problem, but you can maybe find sometimes that they focus on the pain there, but actually this finger is affected as well. So you're actually able to isolate the two fingers as being a problem, so they might look to treat. So it's a useful assessment tool for you guys to be familiar with. Okay.